So today let's understand about Meniere's disease. Very important. You will see lots of cases. Okay, and it is also called as endolymphatic hydrops. See, it is most commonly you can see this in 20 to 50 years of age. Okay, and the probability of getting in male and female is equal 50-50%. It's important because you see lots of OPD cases of Meniere's disease, and what is important is how you treat it and what are conditions. Let's understand it. So in this video I'm going to explain the normal physiology and pathology of Meniere's disease. See, let's understand what is normal physiology. You must remember in Meniere's disease endolymph. Okay, you know about endolymph, right? How? What is normal physiology? See, the endolymph is produced by stria vascularis. Okay, how it is produced? Through, in scala media it is produced. It's through sodium potassium ATPase pump, sodium potassium to calcium channels. It is produced and it is absorbed through, this is all your scala media, scala tympani, scala vestibula, and I've just made it like this part is not so important, right? So here is saccule and here is endolymphatic sac. So all whatever the endolymph which is produced, it is absorbed in endolymphatic sac. So common sense. I said you what is Meniere's disease? It is increased in endolymph. Remember, increased in endolymph. Two situations might happen. Increase in endolymph. One, it may be due to stria vascularis is producing it more, or it may be due to endolymphatic sac not able to absorb it. Okay, two conditions. One is increase of production by stria vascularis. Maybe there is something in salt retentions that leads to increase of production, that leads to increase of endolymph. Done. Or it may be due to obstruction in endolymphatic sac. That is why there is decreased of endolymph, and due to decrease of absorption endolymph, it is leading to increase of endolymph, which is going to lead to Meniere's disease. See, endolymph is increased, endolymph, and it goes to saccule, it goes to utricle. So due to increase of endolymph in scala media, in utricle, in saccule, the dilatation of these three is known as Meniere's disease. Okay, the dilatation of scala media, utricle and saccule leads to Meniere's disease. What may be causes for this Meniere's disease? Just don't look at the handwriting. Hope you are understanding it. One is idiopathic, we don't know. Or secondary, it may be due to the viral infection in endolymphatic sac. Okay, or it may be due to trauma, it may be due to allergy or some autoimmune disease, and a genetic condition in the chromosome 6. So these are causes for the increase of endolymph. Like this might be the reasons. Okay, most of the time it is due to idiopathic. We don't know the reason. You understood physiology. Let's understand pathophysiology. What happens actually? See, अभी stria vascularis has started producing more of endolymph. कुछ हुआ है, it started producing more of endolymph. Okay, and we know that in endolymph we have K plus more, and perilymph we have Na plus more. If you go on deep understanding these two things, you'll never understand the concept. So just don't go with endolymph, perilymph and everything. When there is increase of endolymph, it gets increased in the scala media, it gets increased in scala vestibula, scala tympani. What happens is, due to increase of endolymph, there is rupture. Okay, hope you remember the basic, that this is basal membrane and this is Rene's membrane. This much you just remember. This is a basal membrane and this is Rene's membrane. What happens when there is increase of endolymph? Obviously, the Rene's membrane gets ruptured. Due to the rupture of Rene's membrane, there is loss of equilibrium. There is sodium going, potassium, there is imbalance, mixing of both endolymph and perilymph. Due to mixing of both endolymph and perilymph, there is unequalization going to cause vertigo. And you know, at organ of Corti you have hair cells, which leads to damage of hair cells, that leads to hearing loss. So these are the features of Meniere's disease, and I explained how these features comes in this concept. And what happens is, the most interesting thing here is Rene's membrane, it starts healing by itself. So after some times, Rene's membrane heals, and then there is equalization, pressure get equals and symptoms get resolved. This is how Meniere's disease occur. So in clinical features, what you will write? In clinical features, you write there is vertigo. Why there is vertigo? Due to mixing of endolymph and perilymph. Obviously, abhi mix hua hai, endolymph and perilymph is mixed. After healing of Rene's membrane, it gets back again, right? So when will be vertigo? Vertigo will be for only 20 minutes or 24 hours. That is a feature. And this vertigo is, it may be associated with symptoms of nausea, vomiting, diarrhea and everything. Next, hearing loss. Why hearing loss occurs? Due to the damage in hair cells. It is also due to the mixing of endolymph and perilymph. Now endolymph and perilymph are perfect. Hearing loss, Rene's membrane gets perfect. Hearing loss? No hearing loss. So it is called as fluctuating hearing loss. You will have hearing loss only when you will have vertigo. So it is gradually in progressive in nature. It is due to repeated damage of hair cells. Then we have tinnitus. Tinnitus is, what is tinnitus? Tinnitus is like you feel something ringing in your ear. Like when you go to a temple, you see a bell, right? Tan, tan, tan. The same thing you feel ringing in your ear. But it is subjective. Only you feel it. The opposite person will never feel it. Okay. Then you will feel like fullness of ear due to endolymph, perilymph going, mixing, equalizing. So you will feel like fullness of ear. So these are the features, clinical features of Meniere's disease. So let me explain. There is also another concept where the features are also important. The concept is dilatation of utricle and saccule. Obviously, oh my god, I've made it. You know, right? You must know this. I don't want to take lots of time in explaining these things to you because this is basic. You know, this is semilunar valves and utricle, scala media. These are all the things. See, now यहाँ पे pula scala media and endolymph started increasing. It can go to saccule. It can go to utricle. Right. So here there is dilatation of all these three. That is called as Meniere's disease. What are other clinical features due to this? यहाँ पे क्या होता है ना? There is dilatation of all. Macule, saccule. You remember, you write what macule helps? It helps in linear acceleration, right? So abhi kya hua? There is pressure on macule, saccule. So macule get distorted and linear acceleration gets affected, and you will have drop attacks. So you will fall suddenly. Okay, this is also clinical feature. And here is a oval window. Macule, saccule. There is a oval window. What happens is when some loud sounds are coming, okay, loud sounds come, the foot plate starts moving. यहाँ पे पूरा there is endolymph, perilymph mixing and everything. अभी foot plate is started moving. Okay, it stimulates utricle and saccule, stimulating it. Perilymph, endolymph, they are all mixed, stimulating vertigo. So here is also chance of vertigo. So I am explaining how a vertigo can happen. Okay, there is pressure changes that leads to vertigo, and that also leads to drop attacks. So if you want to know the management and treatment, please comment. I'll continue it in the next class.